My name is Abimbola Adebakin. I was born and bred in Lagos. I did most of my studying and living here in Lagos, Nigeria. I schooled at Tenderfoot Day Nursery and Sunnyfields Primary School, led then by Mrs. Shulari. She was a very strict disciplinarian, and she inculcated in us the basics of being responsible. Our motto then was forward ever, backward never, and that has stayed with me. It gives me, I think it's part of why I have a can-do spirit, that we can do things, we can move forward. So I have very good memories of my days at Sunnyfield Primary School. I then went to Federal Government Girls College, Shagamu. I was in the first set of the SS3 program, and so we were like guinea pigs, but it worked out well. I formed lifelong friendships at Federal Government Girls College, Shagamu. They're still my friends up until today, and they form an integral part of my social network. I studied pharmacy at the University of Lagos, Nigeria. My initial thoughts were to study architecture, but my brother, were two siblings for my mom. My brother then was studying engineering, and it appeared, oh, let someone else do something different. So I wanted to go in for medicine, and due to the JAMB cutoff mark, I tried a second time and realized I was good enough for pharmacy initially. I could have just applied for pharmacy the second time. These were just thoughts that were, guiding my processes. But in retrospect, I'm really glad that I studied pharmacy. So I studied pharmacy as any young Jambito. I came in and there was all the parties, and I enjoyed my first year at Unilag. But along the way, I became a Christian, and the partying reduced and the fellowshipping increased. And we went to Medilag. And somehow or the other, I developed my artistic streak. So I was quite involved in a lot of posters, t-shirts, a lot of things that were artistic. And you remember, I had wanted to study architecture. So that streak came out while I was in the College of Medicine in Diaraba. Along the way, I think I became distracted. I became disillusioned, the study was a lot, my distractions were plenty, and I failed. I failed my third year in School of Pharmacy, and I was advised to repeat. When I say I was advised to repeat, I actually took it as an advice, and I took it to heart. And following that repeat, my GP for each year was a first class GP. And so somehow or the other, I'm glad I was advised to repeat. Otherwise, I would not have realized the potential that I was carrying, that was just lying fallow. And therefore, at the end of the day, I came out with one of the top 3 results of my set, despite the year that I had to redo. And that showed me that I had great potential. Even instead of seeing it as a backward step, I saw it as a forward step. And then, things seemed not impossible for me. I could go anywhere knowing I was an A student. Focused on serving the underserved. So I had worked in Accenture for a number of years when I realized that there were systems and processes one needed to put in place in the health sector. And my first attempt at this was when I started off 3 pharmacies called Karali Pharmacy. They were well taken, but I thought then that there were some gaps and the enabling environment was missing. And so I struggled really hard to make a success of it, but it just wasn't clicking and ticking the boxes for me. I went back into consulting, but I still carried that thought of coming back into my sector to do things from an entrepreneurial perspective that would make a mark, that would actually distinguish itself within the sector and meet the needs of people. I had focused on serving the underserved. And when I say the underserved, these are people who really are not able to, they don't have the luxury of excess capital to do a lot of things, but they are also they need to be served. Healthcare is for all. So I believe fundamentally that everyone should have access to affordable healthcare in a quality that you can guarantee. And so that has always been my issue. If you say in business world, oh, what keeps you awake at night? I think that's one thing that keeps me awake at night. Access, affordability, and quality. So this is my second attempt at approaching healthcare from an entrepreneurial perspective. The other time that I tried to put up Advantage Health, I did it to say, let us aggregate pharmacies so that they are better able to serve the underserved. And the attempt was good, what we have right now. Right now, what we have done is to put in place systems to aggregate pharmacies that are care providers in their own communities. So we launched mymedicines.com on the 1st of October 2017. For us, it was significant because it's tied to Nigeria's independence, and we said, right, we're associating with independence in pharmacy, because for too long we had been given the odd notion that online pharmacies would not work in Nigeria. The regulator would not accept it, they would not allow it, and so on. And we sat back to say, what really could hinder online pharmacies in Nigeria? And we identified a number of things, and we made sure we built mitigants for those issues into our model. Things around delivery, things around prescriptions and controlled medicines, things around a full professional being available to support the care that was given. All of those were built into the system. I believe in the power of collaboration. By Providence, I have worked on certain projects that have showed me that really, if you bring people together with their diverse skills, their competencies, their own access, and their own networks, what you get can be highly formidable. So one of the projects I had worked on while I was at Accenture was in bringing a number of banks together to roll out automated teller machines across Nigeria at off-site locations. So I was the project manager for that for quite a bit. So I helped to handle the operations, the technical, and the business side. And so that gave me a broad spectrum perspective of what you can do when you bring banks together or bring entities together. When you see the proliferation of e-commerce and electronic payment systems across Nigeria today, it didn't start up with one person. Typically, it might have been an idea in someone's bedroom, but it actually came out from the effort of a collaboration. And that is the notion or the model that I have always thought about and brought with me to the health sector. Collaboration really is the way to go. Now, when I set up Advantage Health in 2010, then it was to collaborate and bring pharmacists together for group purchasing, because I simply thought you'll be able to demand better rates, demand better services if you come together as one. But I didn't quite see it through. I thought then that I needed a lot of cash to run it, and I abandoned that project. But having worked I have now seen that it's not about cash. Entrepreneurship really is not about cash. It's first of all the value proposition that you bring to the market. And so now I've come, but this time as Advantage Health Africa. And I've brought new value propositions saying, yes, on the basis of collaboration, we can share platforms. So the first attempt at this was to set up my own online platform. I put up an online medicines ordering platform called My Medicines. It's not to have our own inventory of medicines, no. We've positioned ourselves as the online platform for an aggregation of pharmacies. And that's the first of such a model in Nigeria. So we actually interface with customers. People place orders via our platforms, our channels, and then they are fulfilled via the aggregation of pharmacies. The last mile delivery could be done by the pharmacy or by our new relationship that we've just got with Post through their EMS courier to actually pick up medicines from licensed pharmacies and take to individuals at work or at home. So if you are sourcing medicines and you're doing it for a third party, you must make sure you do it from a reliable source That's one of the benefits of getting your medicines from mymedicines.com. When we incorporated various things that could hinder regulation, we knew we were good to go. And we went and we got approval. Yeah, go ahead. This is the kind of solution we've been waiting for. Now, what has happened is that people appear to have been waiting for it themselves. So on one hand, the regulator told us this was a solution they had been waiting for. And then the market also showed us that this is a solution they had been looking forward to. One surprising demographic that we hadn't really expected were Nigerians in diaspora. Now one question many people ask is, how do you ensure the integrity of the medicines? And how are we sure they're safe, they're not expired? You see, one of the reasons why we carved out medicines from general e-commerce, because this is not us selling shoes or bags and then adding medicines. No, we're all about medicines, and we're really serious about it, because once it is ingested, it's in your body. It could harm or heal you. So we're very particular about the sourcing. We're particular about reliability, and we're particular about safety. That is why each member of our network of pharmacies goes through a quality assurance process, and it's not one-off. We do it routinely. There are some self-assessments they do. There's some assessment that is done by the patients that are actually served. And we also have a robust quality assurance system in place. In fact, you would meet our quality assurance officer, whose whole work is making sure standards are met, standards are kept, and we make sure that the network is one that has integrity. All of the pharmacies are licensed. That means they stand a risk of losing their license to practice if they are found wanting. That's a big deal. So if you are sourcing medicines and you're doing it for a third party, you must make sure you do it from a reliable source. That's one of the benefits of getting your medicines from mymedicines.com. Our whole network across Nigeria is one that is filled with integrity. That's why we've worked with PCN, the community, the Pharmacies Council of Nigeria, as well as the Association of Community Pharmacists of Nigeria. Rather than work alone, we've worked with those credible bodies. So I'm not all about work. For leisure, I love the cinema. I can watch any movie at the cinema, Nigerian, non-Nigerian. So immediately they're coming out, I'm there to quickly grasp, take a look at it and watch it. Apart from cinema, I love reading. So I read a lot. You can see my books. I read and reread. And then I like fine dining. I actually love to be in a place where I can enjoy the setting and enjoy the exquisite meal. So I love fine dining. Maybe a bit expensive sometimes, so I don't indulge in it all the time. But I like to read about it if I can't eat it, or if I can't go there. I can't say one thing has inspired me, but over the years, I think the teachings that I have learned from Pastor Koju Imade, who has been my pastor for over 20 years, and the books I have read and things I have seen around me. I'm a very inquisitive person, and I love to know what's happening in other countries, with other people, other cultures. I think it's been a big success so far, because somehow or the other, I saw myself as an enabler of platforms. So I came to identify who are the stakeholders that I really should be talking to. And I identified the Association of Community Pharmacists of Nigeria as a key stakeholder. And I approached them. I described my model to them. I described the need for aggregation, and they bought into it. So if you're looking for a tipping point in my journey in Advantage Health Africa, I think it was coming together with ACPN, that's the association, to forge a relationship to enable the pharmacies. And what we're doing at this level is to create an enabling environment for each small to medium-sized pharmacy across Nigeria to thrive, to prosper. And if they thrive, if they prosper, the chances are that they will then serve better the people across Nigeria. So Advantage Health Africa is evolving. One of the things that has come out of Advantage Health Africa is that we're operating in 3 or 4 legs right now. One, we've started a joint program with the Pharmacies Council of Nigeria to build new leaders within our sector. We call it the Pharmacy Stimulant Leadership Program, and it has started right now with a cohort of just under 50 pharmacies, inspired to make a change in pharmacy. For me, that is a clear direction that Advantage Health Africa has, to bring professionals to a point of mixing their technical knowledge with leadership and business experience or exposure. That's one direction that we're going in. Another is our enabling environment that we're creating. Together with the ACPN, we have created an entity called CPN Nexus. Now, CPN Nexus is a catalyst. It is an enabler. It's an ecosystem that makes sure that everyone that is a part of it thrives. So you have no excuse not to excel. You now have access to better skills. You now have access to more markets through the online platform and through our collaborations with HMOs or health maintenance organizations. And then we're also attracting capital. All the pharmacies now have access to less expensive capital from organizations that are willing to give funds for either stock, inventory, or for working capital. We've attracted around 600 million naira, and we're seeing more and more rolling in. So for us, Advantage Health is an enabler, and it's operating in a sector that is ready for enablement. The view that entrepreneurship is very little about money, but more about the value that you bring to the marketplace. The view that entrepreneurship is very little about money, but more about the value that you bring to the marketplace. I am in the inaugural cohort of AWEC, which is the African Women's Entrepreneurship Council across Africa. And one of the things that we're promoting is, first of all, what is the value you are bringing to your target market? If you can identify what they do and the hardship that they encounter in doing it, and what your own solution will bring to solve that hardship, I think you're on your way. So entrepreneurs need to see problems as opportunities and not be too laid back that until I find money before I make things happen, and until people help me before I go forward. You need to be dynamic. You need to also learn to pivot your idea if there is a need for it to change. You might be stuck on one value proposition, but guess what? There may be 2 or 3 other things that you can add on to it that makes it a better picture. Be open-minded. Entrepreneurs need to be open-minded. Don't necessarily tie yourself to doing it alone, saying you don't trust other people. You might find a co-founder whose complementary skills makes it worthwhile for you, and that's the name of the game. Choose partners that can work with you and give you a geometric progression in what you're doing. In my career, I've done a number of things. I've gone from organizational performance improvement to human performance and capacity development to corporate governance to building systems, and I've done this across different sectors and for both private and public. Now, along the way, while I worked with the Financial Institutions Training Center as the head of consulting, we had an opportunity to partner with the IFC. And the IFC was looking for a local organization in Nigeria to help it to propagate the message of corporate governance. And I became one of the chosen participants to be trained by IFC and then to become a master trainer of others to propagate the message of corporate governance. So when you work with IFC, you go through a rigorous process, and that's how I became a World Bank consultant. Because doing so with IFC in Nigeria, I also helped to implement similar programs in Sierra Leone, and I'm then listed as a World Bank consultant. In addition, when I left work as the Chief Operating Officer of the Tony Elumelu Foundation, I was quickly invited by the African Agribusiness Incubators Network to help them set up a system for building the network and accessing finance for agribusinesses. Agribusinesses are a core backbone of our development across Africa. And so I saw this as a huge opportunity, because if you can strengthen the agribusiness value chain, then you can strengthen work and employability for a lot of Nigerians, for a lot of Africans, for a lot of our youth. Along the way, I also helped to develop a blueprint for the first AFDB in agribusiness youth program called IAF. And in doing that, I became a consultant for AFDB to implement it. Abimbola Adebakin does not work alone. I have never worked alone. I believe in exchange of ideas and finding the potential in people around me. So the very first person that I employed to work with me is called Olawale. Olawale Adeni is a very young guy, and he showed great promise right from the beginning. He has a can-do spirit, and he formed a tag team with me in approaching the various stakeholders in the early days of Advantage Health Africa. But along the way, we began to identify other people that were kindred spirits, people who, whether they were working full-time elsewhere or available to work with us in full, they formed a part of the team AHA, as we like to call ourselves. There was one that I met via Twitter. His Twitter profile was very intriguing. He wrote there, pharmacist and graphic artist. And at that time, I was looking for someone to translate some of my ideas into graphical form that could be easily communicated. So how better would you have someone than a pharmacist that is also a graphic artist? So it was as though I had 2 in 1, but I didn't know that I was actually getting 5 in 1, and that turned out to be miraculous. Not only did he bring another person called Steven, he also came with the idea that they had also pursued similar to mine, and we forged a strong relationship. So today, myself, Steven, and Murakinyo are co-founders of mymedicines.com. At Advantage Health Africa, we're collaborators. We use technology to enhance aggregation, to make sure that projects and programs are run successfully. We also deploy our own digital health solutions. For example, we're the first online medicines platform that is based on an aggregated system. We create technologies and we help to develop capacity of small businesses within the healthcare sector. In a nutshell, that's what we do. We do all of this in aggregation, in collaboration with key stakeholders in the sector.
Alright, so my name is Murakinyo Adejai. I provide tech solutions here at Advantage Health Africa. I'm also the co-founder, one of the co-founders for mymedicines.com, which is an online drug ordering platform. So at Advantage Health Africa, we're really all about creating solutions for both the health sector and beyond. We run quite a number of products currently, mymedicines.com being one of them, and CPN Nexus as well, where we basically aim to provide access to market, skills and resources for community pharmacies.
My name is Olawale Adeniyi. I'm the HR and admin manager for Advantage Health Africa, and I also project manage the Pharmacist Leadership Stimulant Program, a career and mentoring program for intern pharmacists in the sector. At Advantage Health Africa, we are collaborators and aggregators, and we believe in the power of team. We believe that 1 + 1 = 3++, and then also we are solution providers. We are focused on performance improvement, how we can move from this particular point to the next point. It has really been a great pleasure working in Advantage Health Africa with the talent here, and we hope to take the health sector to a better place and also drive one of the best solutions in Nigeria health sector.